Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Christopher Kunney. He's managing partner at IOTECH Consulting. He's also a podcast host of the Straight Outta Health IT podcast, award-winning, Sway Health
Yes.
award-winning podcast that people should
Yes.
go check out and be sure to like and subscribe. Christopher, I cannot believe we didn't have you on before now, but I'm glad to have you here. Thanks for joining us.
Well, John, thank you. Thank you so much for inviting me to be a part of this program. I'm one of your biggest fans. I follow you, the podcast, all of your publications. Yeah, obviously, I'm a big supporter of Sway Health as well, too. And thank you so much for recognizing the work we're doing with the podcast as well, too, and offering us the Podcast of the Year award. So thank you so much. I really appreciate it and appreciate being here today.
Yeah, well-earned award. People should definitely check it out. And, I think I probably thought I'd already had you on, and that's probably what took so long to get you on here. But
Well, you know what? Interesting enough, you have interviewed me, but it's always been at like conferences and events like that where we've had maybe 30-second to 1 minute sound bites. So
that's
it's nice to
true.
have a longer conversation with you today.
Exactly. We've had you do some short videos for Healthcare IT Today and stuff.
Yes,
So that's great.
absolutely.
Anyway, but for those who don't know you, tell us a little bit about yourself and IoTech Consulting.
Sure, sure. Well, I'm Christopher Kunney. I'm a healthcare technology strategist. I like to say recovering CIO, and health advocate as well. I have over 30 plus years of experience in IT, over 20 of that in healthcare, helping organizations, navigate the intersection between innovation, policy, equity, and patient care. My passion really lies in using technology, not just to modernize systems, but really to humanize healthcare. My company, which I founded actually over almost 20 years ago, but actively
Wow.
running since about 2014, is IOTECH Consulting. We are a healthcare IT consulting and advisory firm. We work with hospitals, public health, startups, government agencies, academic institutions, physician practices, in helping them design, implement, and leverage technology to drive better outcomes and make smarter workflows and make healthcare ultimately more equitable for those we serve in our community itself. Our mission really is to facilitate and foster innovation and care and to ultimately impact the human condition in a very positive way. So we have over 200 plus partners we work with. And again, we work with a wide variety of organizations in the healthcare ecosystem to transform healthcare.
Yeah, that's awesome. Well,
Thank you.
it's funny you call yourself a recovering CIO. I think you're the youngest looking recovering CIO that I've ever met. But you do have 30 years, experience
Yes.
in the industry that you talked about. So tell me, how has the role of CIO changed since maybe you first started? And what skills
Yeah.
do CIOs need to develop today?
Sh- Sure. No, it's a really interesting question because I think about back then, almost over 20 years ago, when I moved into the role of an IT leader and then ultimately CIO. I remember writing a paper. I was vying for the scholarship award for Chime, and you had to write a paper at that time. And I actually wrote a paper called um, "It's Not the Strongest or the Fastest to Survive, that the ones who adapt more effectively to change." And I talked about then the changing role of the CIO, which has absolutely evolved. We've moved from being the individuals who are just primarily focused on the blocking and tackling of the IT infrastructure, keeping the lights on, to an individual who's now become a strategic leader, a transformational resource, and someone who is actually driving and impacting and improving patient outcomes through the use of technology. What's amazing about the role is now, 20 plus years ago, IT leaders were not at the table with the other C-suite executives. They usually reported to the COO or the CFO, but now in many cases they report to the CEO. And they are in the board meetings, in many cases helping to facilitate a large part of the conversations that happen in the board meeting itself. And the one thing I say is that IT is really your next utility when you think about it. It's hard to run a hospital without electricity. It's almost impossible to run one without water and plumbing. And now it's absolutely and impossible, in my perspective, to run one without IT. It actually has become a necessary part of doing business. And because of that, the CIO has now had to transform themselves into a person that can articulate the effective way of leveraging technology to help demystify it so that the decision makers can make better and smarter decisions about it. And then ultimately help drive the value proposition for the use of it as well. Um, those are some of the things I think initially have really at the forefront of what's driven the change in role for the CIO. They're now chief digital officers, they're chief innovation officers, they're chief AI officers. Their roles have really evolved from just, again, the blocking and tackling person who's managing the servers and the desktops to one who's actually transforming healthcare.
Yeah. I mean, I call it, the transition from keep the lights on CIO to strategic CIO, right?
That's correct.
Keep the lights on, it wasn't very strategic. Sure, it impacted the organization, but and some people have had a hard time transitioning. I think that's the
I was just
interesting
going to
part.
comment on that. Absolutely. I was just going to comment on that. There's been many of CIOs that did not want to embrace that change and unfortunately were returned to the community. It's like what I like to
They're
say.
recovering CIOs too.
That's right. Exactly.
It's
But
the
those,
question, did they choose to or did they?
that's right. Either way, they became casualties of it, unfortunately. But those who have been successful at it have gone on to have very long and successful careers, and in some cases, morphed and became healthcare leaders. Some folks have now become CEOs of healthcare systems in some cases, or healthcare executives in other organizations as well, because like the CFO, like the COO, and like the CEO, the CIO has to have a good understanding of the entire operations of the health system because IT touches every part of it. And
Yeah.
so understanding each parts of this business makes them a better and smarter leader, and in many cases can step in and be a transformational type leader for an organization as well too. So it's really interesting to see those who have evolved from being kind of that CIO or chief digital officer to one that's now moved into the CEO role in an organization.
Yeah, for sure. Well, you talked about some of the changes, and no doubt it's been pretty dramatic
Yes.
how much IT is involved in organization these days. But is there something that hasn't changed when it comes to being a healthcare CIO?
No, absolutely. At its core, the CIO is still very involved in keeping the lights on. I mean, the IT infrastructure is still a very important part of the delivery of information and knowledge across the ecosystem. And they still ultimately are held accountable for the business continuity and security and safety of those technologies that are being leveraged now to take care of people and save their lives. Now the desktop, the cell phone, the wearable devices are now clinical devices today. They are absolutely used every day to take care of people and in many cases save their lives. And so that CIO has, I think, even a greater responsibility than they had maybe 30 years ago, 25, 30 years ago, when it was more of the financial and administrative processing of healthcare to one where it's now absolutely critical parts of the delivery of care. So keeping those lights on are extremely important. I think the CIOs still struggle with trying to balance and manage budgets. It's
Mm.
always a very competitive, situation within many healthcare systems operating on very small margins where CIOs have to compete with the rest of the organization on capital. And in many cases, organizations don't always appreciate that technology in and of itself has a life cycle too. At some point, you have to plan for the replacement of it. And you can't just run it till the wheels fall off because now, if you do, somebody's life. And so we still fight for, those small margins of dollars that we get to try to manage the infrastructure. And then ultimately, I think we still are very responsible for the safety, security, and business continuity of the organization. So those things fundamentally haven't changed.
Yeah, interesting. How should a CIO be approaching areas such as health equity, SDoH,
Yes.
and Techequity, new term
Yeah.
kind of coming through? I know this is one of your passions. So,
Yes, it is.
what should a CIO be doing? Like you said, they have so many competing priorities. They need to get the infrastructure up. They need to embrace AI. They need to be
Yes.
chief. They need to be strategy. And now you're throwing on health equity and SDoH and Techequity and all these. How should
Absolutely.
they be approaching it?
No, it's a very, very good question. The CIO has to be more than just the tech leader. They really have to be what I call an equity architect, right?
Hmm.
They have to build systems that not only work for one group, but work for everyone, even those who are most marginalized. And they have to make sure that those tools and systems support those equity initiatives that the organization is managing, whether it's things like social determinants of health, as you mentioned, health equity requirements for health systems, being able to provide information that allows clinicians to look at a certain patient population and evaluate that patient population and treat that patient population based on precision medicine is a responsibility I think that the CIO now has. I also firmly believe that the folks that the CIO lead in the organization, especially as we start to look at things like AI and machine learning and we're collecting data, it needs to be reflective of the community that they serve, right? Because we need to have all views, all perspectives at the table as we're starting to use these technologies to drive better outcomes. And so I think first and foremost, if any organization should have this type of balance in its staff, the technologies that it uses, the vendors that they work with, it's the CIO. They have to be that tech equity architect.
Hmm. That's interesting, Christopher. I think we
Yeah.
had this conversation before because
Yes.
when I look at the most diverse population that adds me on healthcare IT today,
Right.
right? Whether it's LinkedIn or whatever it might be, the most diverse one I ever get is like the Epic certified person,
Absolutely.
insert Cerner, Meditech, whoever you want, right?
Right.
And I look at that and I think they did exactly what you said, which is they needed some internal people to make the EHR implementation a success. So
Yes.
they went and got Epic certified a bunch of people from the local community that were representative of that local community. So it is interesting. Now, I'm not sure it's gone all the way up to the CIO the way it should have,
No, no, we
but
still have a long way to go there. I can tell you. I remember when I became a CIO again over 20 years ago, and I walked some of the rooms of some of the associations that the CIOs typically frequent. I was usually the one of two or maybe three in the entire room. Fast forward, 20 years later, it's probably more like seven or eight in the room now, but more women, still more,
yeah.
I think more diverse groups as well too that you see there, but we still have a long way to go to make sure that um, we are we're leveraging the best people within our communities to take on these roles. And not to go down the rabbit hole of DEI and all of that, because I don't think it's a dirty word, but I think it can be a superpower for organizations who truly embrace the true concept of it. We want to bring together a wide variety to bring unique perspectives to the table. And I think we're all stronger and better when we do that than when we're not. But not to promote people for the sake of promoting them for a certain um, um, backgrounds, but to promote them and to leverage them because of those backgrounds, I think
Mhm.
is what gives us power and strength and makes us much more valuable to the communities that we serve. And to your
Yeah.
point, I think when you look at IT is probably one of those industries that is probably most diverse at the core levels of it. When you talk about the engineering resources, the epic and clinical support resources, because they do draw from the community. I think we still have a little ways to go to continue to see that similar type of diverseness as you move through the higher levels of leadership.
Yeah. Well, there's a power in them understanding the local community in a different way than maybe some others do. So,
Absolutely. Well, they're a part of it. I mean, at the end of the day, their families and loved ones,
sure.
we all have to tap into the healthcare system at some point in time. And so it should be reflective of that community because in many cases, those communities have their own nuances, their own, communication, languages, beliefs, and we
Yeah.
have to factor all that into the delivery of care model. And having people that work in healthcare that bring that perspective to the table just makes us better clinicians, better doctors, better healthcare leaders, and we should be embracing that as much as we can.
Yeah. So, healthcare is getting asked a lot of questions right now. I think, it makes sense.
Yeah.
It's trillions and trillions
Yes.
spent on it, right? So,
Hmm.
should healthcare organizations be worried about kind of new care delivery models,
Good question.
startups? There's a lot of investment in startups, even the shift to
Hmm.
value-based care, and talk about how those are going to change healthcare,
Yeah.
and what that means for the CIO.
No, a very good question. And I go back to, again, that paper I wrote over 20 years ago about it's not the strongest and the fastest that survive, but it's those who are most adaptable to change. The reality of it is our healthcare models have to change in order for them to be sustainable, right? Right now, it's a little bit over 18+% of GDP. If we hit, 24+ percent of GDP, it becomes a very unsustainable model for business. No one will be able to afford healthcare except the very rich. Not even companies will be able to provide healthcare for their employees. And so we've got to find better ways of treating our patients. We've got to move away from just the care side of healthcare to the health side of healthcare. How do we keep people healthier, live longer, and live longer in a healthier way than just treating them when they get sick? So the future of care shouldn't be something we fear. It's actually something we should be kind of shaping and creating these models of care that's a more effective way of managing people as they move through their life cycles. And so if you're not thinking about these models and if you're not embracing these models, you're really already falling behind because there are others who are doubling down on this and they're finding this as a very valuable and their proposition and seeing real ROI from it. And so when you think about the different components of that model, whether it's health systems or startups or organizations who are now moving towards these models of things like value-based care, um, yeah, the value that we get from that and the opportunity that we get from that is leveraging these types of organizations to help us move down that path more effectively. For example, these new models of care where they're more distributed, they're more personalized. You've got now retail clinics, you've got patient-centered medical home, you've got value-based care models. In order to prepare for them, we have to think about how to deliver health differently. We can't do it the same way. And so companies in their delivery, and so that makes it easier and more effective for us to implement solutions that are a lot more cost effective than we might be able to do with technology companies as well too. Value-based care is something that I think as we think about this silver tsunami, and I've been talking a lot about this whole concept that the last baby boomers turned 60 last year, and the first Gen X's turned 60 this year. We're moving into this tsunami of people who are now starting to move into their senior years. By 2030, there'll be more people over 65 than under 5 years of age. And by 2050, 2 billion people across the entire world will be over 65. We literally have a youth shortage. And by the way, many of those folks are in healthcare, right? And they're now retiring, they're getting out of healthcare, and we're not replacing them fast enough. And so we're going to have to depend on more innovative ways of delivering care in order to satisfy this number of people who are now moving into their senior years. Again, in the next 10 years, 40% of most doctors' patients will be over 65. But yet, many of them are not trained in geriatric care. We're going to be losing specialties like cardiology or radiology, rheumatology, all the ologies that as you deal with as you get old, podiatry, all these things. And so here's where technology, or what they now call age tech or silver tech or granny tech, comes to play. How do we now leverage these things to help us manage this growing population of people who are moving into their senior and do that in an effective way so that we don't get wiped out by the tsunami of people who are going to be moving into their silver years. It's actually a $7 trillion industry right now. And so if organizations start thinking about what the strategy is, they can embrace it and take full advantage of it. And it could become a very interesting ROI for them if they embrace it appropriately. So I'm excited about, value-based care. I'm excited about things like age tech. I'm excited about startups who can bring more innovative approaches to healthcare and are willing to partner with healthcare organizations to build the right solutions to address these challenges.
Yeah, that's awesome. And there is so
Yeah.
much going on.
Yes.
Yeah, one of the things I love about having a podcast, or I guess in my case, five podcasts, but is
Yeah.
learning from all
Right.
the guests, right? I have a front row seat to learning from guests. I'd
Yeah.
love to hear what are some of the lessons you've learned doing the Straight Outta Health IT podcast?
Wow, man, I tell you, when I started this experiment, and I literally called it an experiment about 3 years ago, I never ever imagined that I would still be doing this. I just wanted to see if it was possible. I said, what's the worst that can happen? People don't listen. Okay, then I'll go away quietly into the dark and go do something else. But what I've learned through this journey is that there people have a lot to say, and and there are people out there that want to hear it too, and that healthcare is personal. I mean, we talk about on my podcast, as you do as well, patient journeys. We talk about the evolution of technology. We talk about innovation and what's coming out. And it's a very broad perspective of what is happening in this industry, and I'm excited about that because you know again, there's no one silver bullet to solving the challenges that we have in healthcare. And so it is going to take a village. And then to bring these individuals, because it's the podcast, I'll be first person to admit, it's not about me. I'm not a very good interviewer.
I don't know if
I
that's
don't
true.
have a winning personality. It is about the guest and them telling their stories and advocating for those things that they're about and talking about innovation in a number of different ways. And innovation doesn't always mean technology either. It
Mhm.
may be just a different way of doing business. It may be a different way of looking at how we treat patients. It might be something around how we advocate for things a little bit differently as well too. And I think for me, it's been a very holistic um, journey that's helped me become a better advisor, a better advocate, and someone who I hope I can take those experiences and share with my clients, so that they become better care providers as well. So it's been an interesting journey for sure.
Yeah, that's for
Yeah,
sure.
yeah.
Well, we always like to wrap up our podcast with a little career discussion. And I know your father has been a really influential part of your life. So I'd love to hear, what lesson did you get from your father that would be helpful to CIOs or even aspiring CIOs?
Good question. I think one of the things and my father, first of all, was my hero. I grew up, I mean, and I don't know if how many people can say that, but he absolutely was my hero. Probably one of the smartest, hardest working, and well-respected persons I know. I lived on a street named after my dad.
Wow.
So that was a lot to live up to.
I would say so.
Um, and one of the things that always impressed me about him, and he was a servant-minded leader. He never led from above. He always led from among the group.
Mm,
You would never see him ask someone to do something that he wouldn't do himself. And in fact, he would set the example in many cases. He would set the bar that others would have to achieve just because he was committed to whatever he believed in. And I think I took that as my founding principle about how I try to lead as an entrepreneur in the past, as a IT leader, as an advisor. It's not just telling people what to do, but getting in the trenches and showing them how to do it as well. I think the other thing he taught me was um, to always be a risk taker, but be a calculated risk taker, right? Whenever I take on a project or a new initiative or whatever, there's a couple things I ask myself. The first is, what's the worst that can happen, and can I survive it? Because if I can survive it, then it's a pretty calculated risk. If I jump out of a plane without a parachute, that's probably not a good decision to make.
Not a good risk.
Right. But if I jump out of one with one, there's a strong possibility I will survive it. And what an experience I'll have, in doing that. And so I've always operated with that mindset. And then the last thing I try to remind myself of, especially as I get older now, I don't want to look back on my life when I'm taking those final breaths and my life is flashing before my eyes and saying to myself, I wish I would have
Mm,
done that.
yeah.
Yeah, even if I tried it and it didn't work or failed, I failed at it, at least I would have tried. I don't want to ever look back on my life and ask myself, why didn't you take a chance at that? Why didn't you take the leap? And so the podcast was a great example of that. I never thought I would do one, but something told me to try it. And what's the worst that could happen? And can you survive it? So I've always tried to operate with those principles. And then finally, always try to find the why and what motivates others and then to empower them to be the
Mm,
best versions of themselves as well too. I always measured myself as a leader by the number of people who I developed become leaders as well too. And I think that's a great measure of yourself. And then finally, especially as a consultant, you go into organizations, they don't always take your advice, but I still give them an invoice at the end of the day. But I do ask myself, did I leave it better than I started? Right?
mm,
Because it's still always this concept of continuous process improvement. And I always want to try to walk away from anything I've done and ask myself, if I left it better than I started, then that's a win too. You
yeah.
may not have fixed everything you wanted to, but you at least made it a little bit better.
Yeah, that's
And so,
interesting.
yeah, so I try to operate on those principles.
Yeah, I 16 years ago, I asked myself a similar question to what you just
Right.
described, which was if I don't quit my day job and try to be an entrepreneur, I'm
Hmm.
gonna regret this for the rest of my life. And so,
Yes.
that's why I quit.
Yeah,
There's a lot more
exactly.
of the story of how I got here, but it was it was that exact question. It's like, hey, if I don't do this, I'm going to
Hmm.
regret it, and I'm gonna say, why
Absolutely.
didn't I do it? So
Yeah, and
that's
and I just
interesting.
wrote a blog on the road less traveled too. If you get a chance, I'll send it to you. And I talked about that. It's that road less traveled that many of us take that isn't comfortable for some. And it's not judging one that doesn't take it, but for those of us who have that bug in us, who have that fire that's burning us, say, I gotta do this regardless. I gotta burn the ship and just go conquer this country, this land.
Mhm,
It's hard not to do it because you don't want to wake up one day and say, "Wow,
mhm.
I regret not doing that."
Yeah. Your
Yeah.
dad's advice is interesting, though, and his example really. I've thought a lot about servant leadership, and
Hmm.
many times you'll find me handing out badges at Sway Health
Hmm.
at the conference,
Yes.
right? Or moving
Yes.
chairs around or things like
Hmm.
that. And I have many people tell me, like, why are you doing that? Like,
Hmm.
and I think their intent, which is this is the tough balance between
Right.
the advice of servant leadership is I think their intent is, isn't there something more valuable you could be doing as opposed to moving the chair? But your
Right.
advice, I think, is important too, which is I'm not above doing
That's
anything,
right.
any of the tasks that are there, just
Exactly.
I'm the founder or whatever, right? So
That's right. And
it's an
ultimately, it's
interesting
your
balance.
baby. It's your baby too. I mean, it's like
Yeah.
you the analogy of taking care of your child. Your child, a baby and they spit up. Whose job is it to clean them up? It's
Yeah.
mine. Point the
Yeah.
finger and say, well, somebody else do it. I might like someone else to do it, but guess what? Ultimately, that's my baby. And so I want to take care of my baby. And that means me rolling my sleeves up and moving chairs, passing out badges, doing whatever I got to do. That's okay. And I'm okay with that because I get joy in making sure that everyone else is having a good time and
Yeah.
experiencing the positive impact of what you're bringing.
Yeah, I mean, we have probably a different problem. I like some of the mundane stuff that I have to do. And
Right.
people are like, why are you doing it? Like, well, I kind
Right.
of like that,
Yeah.
I heard this about Craigslist, right? He answered all the support calls, and they're like, why are you doing that? He's like, that's what I enjoy doing.
Right, right. Yeah, exactly. Well,
It's
you know your
interesting.
why, you find your passion, and sometimes being a good leader is also knowing what you do well and letting others do those things that, maybe others traditionally think you should be doing, but maybe someone else does it better. And
Yeah,
so let
for
them
sure.
step in and take on those roles.
Yeah,
Yeah.
absolutely. Well, Christopher, I appreciate you coming on this episode of the CIO
No,
podcast. I love learning from you. I always love
thank you.
connecting with you, so I appreciate it. And thanks everyone for watching and listening. If you want to
Thank
find more
you.
great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting application. Thanks, Christopher.
You're welcome. Thank you. And I like that cup behind you, by the way, too.
Yeah, straight out of health IT.
Absolutely. Thank you again. It's been a pleasure, John.